as we all know, or if we don't know, I'll share that as practitioners, the practice of compassion feels like a giving to others. And yet, it's also a practice of receiving. It's really a practice of receiving. When we do the practice of compassion, our heart feels more filled, filled out with care. We feel more resilient ourselves in this sense of connection. And I was actually listening to an interesting podcast last week. It's part of what's called Freakonomics Radio on NPR. And the title of the theme was The Compassion Crisis. Compassion crisis, and specifically to refer to the compassion crisis in healthcare in the US, where many doctors, many nurses, not really being taught, not really being supported in compassionate practice, how there is a sense of burnout. Both their compassion gets burnt out, and also they feel burnt out. And these two researchers, both clinicians, doctors, as well as researchers, they really unearthed lots of research that has been done on compassionate care, on compassion, or what is termed as patient-centered or patient-centric practices that really show how not only patients feel better when there is, and they're actually not just feel better, but there's really outcome. There's clinical outcome that's measured for patients, that when the practitioner is expressing compassion, that the outcomes are actually improved. Not only that, but actually what's called helper's high, again in this literature, helper's high, which we know of as practitioners. The helper's high is when a clinician is more compassionate, they feel better. They feel better themselves. They have less burnout, less depression, etc., etc., etc. So, and they feel better about their work. So, and so these researchers wrote this book called Compassionomics, the economics of compassion, which again, knowing the healthcare system, etc., needing to have numbers, really showing how outcomes are better when there is heart, which of course you go, duh, yes, of course. We know this as human beings. And yet it's interesting, I think, for me also as a scientist to um, um, to consider that, yes, of course there is data, and I'm delighted and grateful that there are people who are looking at the data and bringing up the data to convince others who might think, oh, it takes too much time to be compassionate. Actually, it doesn't. It turns out it takes no more time to be compassionate. So with that, I wanted to invite us into the practice of compassion tonight, to cultivate it in our heart, and whether or not we are in a caregiving professionally, we're all in a caregiving profession. We're all human beings. We all have people we care about. We all have people who are in distress, maybe not with COVID, but different challenges in life. So practicing compassion, supporting them, supporting ourselves, supporting this connection, this human connection that we have.